anybody who struggles with perinatal mental health in any degree, whether that's postpartum depression, OCD, or postpartum psychosis, like I had, if there were providers and prescribers and therapists in their area that are knowledgeable on the signs and the symptoms, we would not have such a high amount of suicide attempts in young moms.
What impacted me and influenced my decision to attend the PSI training is the fact that I know that the communities that I work with need those resources. They need to work with providers that have the knowledge that is gained from that training, as well as an understanding themselves of what it is that not only they are facing, but the knowledge and understanding that the problem is not them.
Really, as a provider, trying to access care and access care with other providers that were knowledgeable in perinatal mood disorders, knowledgeable in medication use around breastfeeding, was really challenging. And I had a very difficult time accessing that care and the care that I needed. On top of that, I began to see more and more individuals in my own practice that were experiencing mental health challenges after birth or during pregnancy. I just really began to experience on both a personal and professional level the real need there was within the community. And so I identified that I could do some training through PSI. I did their 2-day training, and then it really just extended beyond that. Have done some more training through them and through some other organizations.
From my experience, when I was in the state of anxiety, they felt like I was like on drugs. Like they thought that I had taken something. We have to prepare our medical professionals to be able to treat people who are having mental health conditions in the moment. And so better training in the medical field will help. Thankfully, our child wasn't taken away from us, but there are stories where people get their kids taken away. And that shouldn't happen.
I did my training in 2014, which was 7 years ago. It, in my opinion, further legitimized not only my therapeutic approach and my work and my practice, but also gave a lot of legitimacy to the perinatal mental health struggle in general when I was speaking with medical professionals, other doulas, nurses, OBs, other therapists, that this specific function, the specific population, the specific approach really does tend to a special population of people, and that general therapy approaches don't always work.
I had a miscarriage prior to the pregnancy with my son, which very much increased my pregnancy anxiety. And then after the birth of my son, my anxiety increased more because now I had this tiny human that I had to learn how to raise. So I ended up not getting a referral. I think it probably would have benefited me a lot to have someone that specialized in perinatal mental health to have a conversation with me. I feel like someone that struggles with those same issues that I dealt with, that's important to know that, hey, I've done X amount of training, I have this kind of experience, let's have a conversation. As a professional, that's part of why I went to the training through PSI, and it just finally clicked and made sense, and I felt heard even in a crowded room full of strangers who were just trying to soak in as much information. And I was so glad to be there and so appreciative that there were others out there like me that in a professional setting wanted to learn more and wanted to know how to help not only the moms, but the families in their communities.
My biggest takeaway from attending the PSI training was that postpartum mood and anxiety disorders range far beyond postpartum depression. Learning at this conference that there's a large gamut of mental health disorders, anxiety disorders, mood disorders that can affect the birthing parent and even the support people of the birthing parent.
After my daughter was born in 2017, right after she was born, I mean, that very same night, and even especially the next day, it just kept getting worse of seeing things that you would think were like, out of maybe a horror film or something, that nobody, these things don't actually happen. But I was seeing my daughter, her eyes were red. I was hearing voices of what I assumed to be, a demon or the devil that was trying to take my baby. Things like that progressively got worse. And I would mention something about it, but everybody was saying, oh, it's just, sleep deprivation or leftover, maybe some leftover painkillers that were just kind of messing with things. So, I went home from the hospital. About 1 to 2 weeks in, I was convinced that my daughter was not my daughter. She was a baby. She was in my house, but she was not mine. She was someone else's. I was hearing phantom crying. I was taken off of all of my antidepressants and put on other medications that over time led things more and more downhill until at 4 months postpartum, I attempted suicide. And only at that time was I put inpatient on a mandatory psych hold for 3 days. And during that time, they still could not put a name to what was going on with me until finally I got back out of outpatient. I got back to my midwife, and she was the one that actually found a medication combination that worked for me until I could finally start getting better. If there were providers and prescribers and therapists in their area that are knowledgeable on the signs and the symptoms and how to best treat those people, then we would not have such a high amount of suicide attempts in young moms. We wouldn't have such a high maternal mental health problem.
I hope that PSI continues to do these trainings and we can get more professionals trained so we can help more people, because it's needed. It's so needed.
Moms need support from other moms, and having trained mental health professionals in the community that can provide that support, that can help direct moms to what they need, make referrals as possible, answer questions that are specific and unique to this population, and still provide a safe, nurturing environment for moms to give each other support is absolutely an unmet need across the state and in individual communities.